on.
Okay, it's on.
Okay, so I'm going to pretend like I'm him. So now come right here. And what I'm going to have you do is come in front,
Okay.
put your hands here,
Alright.
and I want you to kind of pull me forward.
Forward.
And then that's going to help to unweight the back a little bit.
Okay.
So every hour, half an hour to an hour, just bend him forward to unweight that back.
Half an hour?
Uh-huh. And then hold it for about 30 to 60 seconds.
Okay.
And then take them on back. And that will markedly help that degree of pressure. Okay?
Okay.
And it's mainly along the bony prominences, along the base of the back of the spine, and then where the ribs kind of flare out. Okay? And by bending them forward enough, you'll also get off a little bit of unweight the buttocks too.
Okay.
And that will be very helpful too. And then the other issue is keeping them clean and dry. Okay, so any times that there is an issue in terms of moisture, then that can create a problem, a vector or an avenue for the skin not being as healthy. But it looks good. It's blanchable. There's red marks, but it's blanchable. Okay.
This is what the other nurses
Yeah, that's
said.
right. That's right. And so it's the bony prominences that are the factor. Okay, now, sir, I'm going to go ahead and do some passive range of motion. Okay, and this should help. The passive range of motion should help to kind of help them feel better. Okay, and what you're going to do is you're going to take your hand underneath the heel and underneath the hand, and you're going to slowly just bend him up like so. Does that hurt at all, sir?
What?
Does that hurt? Beautiful. Not yet? Good. Okay, and it's done gently in terms of pressure, and you just hold that stretch for a little bit, and the other leg is going to be nice and straight. Okay.
So you're not really gripping the...
You can.
Okay.
So you can grip a hold.
Alright.
You know, place it, kind of cup it like so. This is another way that you could do it.
Oh, I see.
But the key point here is you don't want to go fast. It's a nice, slow, fluid movement. And from your back's perspective, you want to have your feet widely separated
Okay.
so that you can shift from one foot to the other foot.
Okay.
Okay? Does that make sense?
Yeah.
And you want to use good, healthy back techniques yourself.
Okay.
Okay? And then coming on down that third time, I'm a big believer in the 3 with the stretches. Okay? So after the third time, you come down here. I've got his hand, I'm cupping the heel. Okay?
Okay.
So my hand is here. The foot basically goes on the forearm. Okay?
Alright.
And then you just gently come up like so and stretch. And it's a weight shift. So it's not your arm doing everything, it's the weight shift that's accomplishing that. Does that make
Yeah,
sense?
yeah.
Okay. Does that hurt?
Yeah.
Oh, I'm sorry. And then if it hurts, then you back off the scotch.
Okay.
Okay? And then if
How
it's
many seconds do you do that?
maybe 20 seconds,
20
and then
seconds.
I'll go ahead and just gently do a little bit of an oscillation there, just to kind of keep the range. Okay? Now, sir, I'm going to bring your leg out to the side, out to me. Does that hurt at all? And then back again. So again, I want to have 1 foot forward, 1 foot back. So I start here, and I'm here.
Okay.
Okay? So you want to protect your back. Okay? And then I'm going to cup the heel, go underneath the knee, and just gently out. And gently back. Okay? How about if you try it on that side? Okay?
That's
Okay. And then one more, I almost forgot. The other one is hamstring stretch, and this one is going to be his tightest. I'll just tell you that right now. And that's the back of the thigh. And what you're going to do is you're going to cup that heel, and you're going to slowly go up.
About how high?
You're going to feel tension, and he's going to give you an indicator. This is one that you want to go up really slow. Right about here is where I feel the end. Yeah.
Okay.
And when it goes, oh, that's your cue to bring it down a
All right.
scotch.
Okay.
Okay? Does that feel comfortable, sir?
No.
No. How about there?
No.
Okay, you feel a little bit of a stretch or a lot of a stretch?
A little bit.
Okay, a little bit is okay. A lot's not. Pain's not. Okay? But this is his tightest muscle. Okay, normally a person should have 70 to 90 degrees. And part of the reason why he sits in a slumped posture like this is his hamstrings are tight. And so it's pulling his pelvis back like so. And so a scotch of a stretch is okay, but you have to be slow and gentle is the key variable.
Scotch meaning very little
Scotch
bit.
meaning a tiny itty bitty. And you watch the individual. You know, you just, you're basically, you get here, and I'm going to watch him. I'm going to go up nice and slow. And when he tells me, oh, you okay? Is that too much?
Yeah.
Okay. I'm going to back off a little bit. Is that comfortable? You feel an itty bitty stretch or a lot of a stretch?
Okay.
Okay. If he says itty bitty, then it's legal. Okay? All right.
I'll do it this way.
Yeah, let's do this first. This first, okay? All right? Get a hand, here, now, sir, I'm gonna move that hand. Good, good. Come up a little bit more so, because how tall are you, sir?
6'4".
Okay, yeah. He's got a little bit of real estate you gotta get through.
That's for how many seconds?
30 seconds to a minute.
Okay.
Are those you guys?
That's my Beta and her brother Greg. Our brother
your
Greg.
brother, that's a boy. Okay, so
Yeah.
now my contacts are clearing. Yes, of course, that's a boy.
Mhm.
So you were shortly after that then?
Mhm.
Too cute.
Yeah.
What did you do for a living, sir?
Plumber.
A plumber. All right. Can I bend up again?
How is it?
Okay.
Okay. You enjoy it?
That's not a good sound.
Very good, and then slowly come on down. And then go back up again. Comfortable, sir?
Yeah.
Okay. And that's pretty good. So several seconds and then come on back down. Good, and then one more time. And then come back down. And now you want to stretch out the calf, and that's going to again look like cup the heel, put on the forearm, and then gently weight shift. Feel okay, sir?
Yeah.
Okay.
Oh.
Alright.
So you hold that static stretch for a little bit. And then the other one he might enjoy is this, just going slowly back and forth. Kind of a reciprocal movement. One direction and then the other direction. You doing okay?
Oh.
You feel it, huh? It's towards the very end. We'll slow down as we come up. Is that better, sir? Yeah. Okay, and then the last one is giant, what I like to call giant pair of scissors, out to the side. Okay?
Ramier was looking for classes to take in home health care.
Okay.
Do you know any programs?
They're
or-
the aid level. So a physical therapy aid would do it, and there are some community colleges that actually offer that.
Nearby?
I would have to do a search. The closest one I definitively know, gosh, I'd have to do a search on that. I used to have that right up in the top of my head,
Okay.
not so much right now. So, but it's, the information's probably out there. I'll see if I can do a search
Okay,
for
thank
you.
you so much.
There's assistant, PT assistant too,
Okay,
which would be the next step up. And that's a 2-year AS program.
2 years.
Uh-huh.
Okay.
And then you would act as an assistant to a physical therapist.
Oh,
So, yeah. A bit more of a commitment. But you'd be licensed.
2 years. Oh.
So,
We're getting to where we have 6 minutes left.
okay.
Should I turn it off
Yeah,
for now?
fair enough.
Okay, very good.